Hey everybody, it's Josh again. I am gonna do another update to my tibial tubercle osteotomy, patellar realignment surgery recovery, as well as the accompanying surgeries that they do in conjunction with it. So I'm about 8.5 weeks out from my right knee patellar realignment surgery, and all of a sudden I'm blinking how far out I'm out on my left knee. I think I'm right around 7.5 months out on my left knee, if not almost 8 months out on my left knee now. In regard to the healing process that's been going on, things have still been going really well. My left knee, now being 8 months out, is every week I'd say it goes through increase in range of motion and ability. I'm pretty happy with the results of the procedure. There's a lot of tenderness and soreness still in the joint, but that's gonna be expected for me especially a long time to come. I think really most people that have the surgery done, it's a pretty long process of getting past the general pain and swelling, or the pain and just general tightness that you feel in there. They say when you go in for the surgery, they tell you 6 weeks in a immobilizing brace, 6 weeks later, you're considered fully healed. But that's really not completely accurate. I mean, that's when the joint is fully healed, meaning that the bone fusion has happened for where they moved the patellar tendon over and things like that. But that doesn't mean you're actually fully healed. There's a lot of muscle adhesions and scar tissue that break up for a while. And actually the bone, where they moved it, resurfaces itself and is still building its foundation for up to a year after that. So all that plays a role in the recovery of your legs after this procedure. So don't be down on yourself if you had it and you're 3 months, 4 months, 5 months, 6 months out, and you're not back to elite athletics or doing anything that you're used to doing previously without a little bit of difficulty. I still, I'm very, very meticulous with following the training protocol to get my legs back, but I'm still a long ways out. So just, give it time like you should, and things will go great. I want to talk a little bit about my right knee as well. So I said 8.5 weeks out of my right knee. It's, in comparison to my left knee, my right knee has been a lot stronger. I've been able to feel a lot more strength in it than when I did my left knee, and also my initial level of dexterity has been a lot better as well. I've been able to get on a bike now for a little over a week and give some pretty good pedaling at the gym, which with my left knee, by 8 weeks, I was barely getting enough rotation and stretch in my knee to feel like I could do anything. So there's already a lot more dexterity in my right knee, but now it's just a matter of getting some strength built up. In terms of healing, it's going well. My kneecap, as far as I can tell and feel, is in the place that it's supposed to be in. It's definitely really tender still and really sore on a lot of days, especially with all the therapy I'm doing and stretching. But I got to get that range of motion back, as all of us do after we do these procedures. I want to really quick talk about a few things that I've had through the process that if you're going through the surgery you may have coming up or maybe dealing with. And a few things so there's a lot of discussion about this brace right here. This is a sometimes prescribed immobilizing brace for some orthopedic surgeons. They'll prescribe this one. It's a functional immobilizing leg brace where it locks at different degrees, and then it can be given a certain range of motion just by adjusting the clasps as you get more dexterity and more health back into it. I personally didn't like this brace. My doctor actually didn't, he generally told me to wear the standard immobilizing brace, which was this guy right here. This is the cheapo one the hospital hands out that they lock on your leg. It does not have any settings to adjust. But actually I found this to be more comfortable on both of my knees through the healing process, simply because this one has these straps that wrap around your leg in different spots, and I felt like it kind of squeezed certain spots on my leg instead of this one, which offered kind of a equal amount of pressure all the way down my leg. So to each their own. Some people have really talked about wanting to use one of these braces. Some of my newfound friends on the tibial tubercle osteotomy support group have mentioned that. In my experience, this one worked for me, but I know a lot of people got this one and it's worked out better. I think it's more of a, I think it's a personal thing. Sometimes one feels better than the other, and in another degree, I think it's just what the orthopedic surgeon prescribes and what works best for the situation. So, but I have both obviously, and I use this one now. I've adjusted it so it's just a support for extra, give me a little extra strength in my leg, making it feel a little more stable so I can do a few more things. I wear it if I'm gonna go on a really long walk or do any distance stuff just to be safe with my knee, because it being so early out of surgery, my right knee can still pretty easily buckle. So there's those guys. And then in addition to that, I got a really nifty small brace, which I think is a very common one handed out for patellar stability issues. And what this one does is it's got this groove right here that actually clasps against the side of your kneecap. And it just helps give a little bit of pressure to holding your kneecap in place, just in case as it's recovering, you're having a little bit of, when it's recovering, we're really, I don't know about any of you guys, but I was very nervous throughout my entire recovery. Every time I felt any little thing, and still do, like, oh my gosh, is everything okay? Is my kneecap where it's supposed to be? Is something moving around? What's that pop, crackle, fizzle thing going on? And all that's normal recuperative stuff, and generally speaking, your kneecap doesn't do much. You just think it does a lot. But something, and even if it does move around a little bit, early on in the stages, it's not, if you push yourself too far, buckling does happen, and people have falls and spills, and sometimes nothing happens and they're fine, and sometimes it can be a big deal. So on really hard workout days for my left knee when I go to the gym, I'll actually take this brace and I'll just put it across so it really gets a good grip on my kneecap right there and wraps around. And it just gives me that extra support I need on the patella specifically to do a lot of range of motion exercises. And on a general basis, what I do almost on a daily basis around the house just for basic level therapy, I have all these fun ankle weights. I've got tons of these things that I bought after the procedure. I've probably got like 50, 60 pounds of ankle weights. And I'll literally wrap these all the way around my leg, right and left, to give a little bit of extra weight bearing, and I'll just integrate it up pound by pound. And I do leg extensions with this, but I do partial leg extensions. So if you're able to see, when I do this, I only go down part of the way and back up and hold to get that quad firing as much as possible. As you can probably see too through the video, and I mean, I guess this may be a bit of a vanity thing for me, my legs through the process, I've always had a little bit of issue putting on a lot of size on my legs, but through the surgery, it's really, my legs are really shrunk because I've lost any type of muscle mass that I've built on my legs throughout all that time. But I'm looking forward to it coming back and being able to show progress pics, because I think everyone suffers from this, where you have this surgery, it's really invasive and you lose a lot of the muscle in your legs, and if you're active like me, you wonder if you can get that back, or if you're gonna kind of look stick-legged forever. I have a very staunch goal to get all that built back into me, so that'll be in future videos. Another thing that I have in particular that everyone's not recommended to have, but I've been recommended for, is a TENS unit. It's a musculoelectrical stimulation system. I in particular was a good candidate for it, one, because my legs are so lean, the electrodes are really easy to get right onto muscle tissue. If you've been prescribed this, great. I've been prescribed this. I've used them throughout the years with my knee issues. A lot of orthopedists won't prescribe these. A lot of therapists won't. They think people don't know how to use it correctly or will misuse it because it is electromagnetic or electrostimulation in your muscles and nerves, so it could be a problem. But I was prescribed it, and I kind of want to give a quick, if you are using this or thinking about it, I want to give a quick rundown of the function of this and how it works. So for me, there's different settings, and in particular the one I have and what works best for stimulating muscle tissue specifically is the settings in what's called NMES, which is specifically the musculoskeletal electrostimulation. There's ones that kind of focus on nerves and stuff like that, but I use that one. And setting wise, these all have different settings. I usually crank mine up to about as high as it can go, and you'll be able to notice I have the electrodes on my VMO, and I have it on my medial quad as well. And as you can see, my leg's going up. I'm actually not pulling my leg up at all. It's the electrodes firing on my quad, and it's causing the muscles to fire. And I'll do sets like this at a pretty high setting, and it goes for about 15 seconds, then it lets off for about 15 seconds. That's the wrap that I use. It shut off, and then I let it go down about 10 degrees, 30 degrees. And then once the fire's back up, I'll do a second round. And I do this a lot. I basically was informed that I could do this as much as my legs could physically handle just to try to stimulate that muscular growth. So that's my current routine. Sometime in the near future when I can muster it up, I'm gonna try to give you guys a video on my workout regimen at the gym. I currently just evolved my workout routine into doing twice-a-day workouts, one early in the morning and one after work, trying to really build up that muscle tissue and do some mass building to put some meat back on me. Throughout the surgeries, I lost quite a bit of weight and I really wanna maintain a good healthy size. So I'm doing that right now, and I'm gonna try to give you guys a good demonstration of that sometime in the near future. As usual, I hope the video was helpful, and I'm sorry if I sped through a lot of things, but if you have any questions or comments, you're always welcome to ask, and best of luck with your healing. Thanks.